Hello everyone, thank you so much for watching. So this is really just a quick informative video for anyone who is curious about what we do in the Cardiac Cath Lab, or you're thinking about working in the Cardiac Cath Lab, or you currently work in the Cardiac Cath Lab and you don't quite understand everything going on. This is really a basic video, so if you're more advanced, this is probably not for you, but just to understand it real quick. Okay, so let's dive into it. So before you understand, in order to understand what we do in the Cardiac Cath Lab, you need to kind of go back to your anatomy just a little bit, your anatomy of the heart, right? Know your vessels, know your vessels that are going in the heart, coming out of the heart. Know also the vessels that are supplying the muscles of the heart, and that is your coronary arteries, right? So that's the red one that you see on here. Those are big game changer when it comes to in the Cardiac Cath Lab, right? Those are the ones that we are primarily going to be assessing when a patient comes in with a STEMI, meaning they're having a heart attack and it's causing ST elevation in their EKG, chest pain, the typical signs of a heart attack. Immediately that is usually a sign, not usually, that is a sign of a blockage, right, in the blood vessels that is supplying the heart muscle. So that's usually a blockage in your coronary arteries, okay? But if this is just a regular diagnostic case, patient has been having chest pain, or they've had a stress test, abnormal stress test, the doctor will do just a diagnostic, right? So there's several different diagnostic testing that we can do in the cath lab. Diagnostic just means like they're trying to diagnose what is causing the abnormal stress test, what is causing the issue at hand, right? The baseline issue. So back to the anatomy, just real quickly, I'm going to make sure that you got it, right? Know your pulmonary arteries, know your aorta, your right coronary arteries, you have your right marginal, which is a branch off the right, the RCA, and then your left coronary artery has a branch that kind of wraps around to the back. It's called the left circumflex artery, and then it has another branch that is your LAD, right? So your left anterior descending artery, LAD. And then you have off the LAD, you have your diagonal branch, okay? So sometimes you'll hear the interventional radiologist say, it's an occlusion in the left circ, or 90% or 100% occlusion in the right marginal, whatever it may be, right? So if you know your anatomy, that really helps. I know that's one thing that was hard for me when I first started. Okay, and then when we are also know your right ventricles, your right your right ventricles, your right atrial, your left ventricles. Just know all the different chambers of your heart. That will really help you as well, especially if they're doing pressures. Okay, so let's get to the diagnostic testing that they do. So the first one is a coronary angiography. So coronary angiography is if they are only just going there to visualize the coronary arteries, right? So if the doctor's only going there to visualize the RCA, the LCA, and the rest of the arteries, the coronary arteries, right? So we call that a coronary angiography. Oftentimes what you'll see is we'll start it off as a left heart cath, right? So it will be called a left heart cath or right heart cath, but primarily with the left heart cath, right? The only difference between the left heart cath and the coronary angiography is that with the left heart cath, we are still checking, right? We're checking the coronary arteries to see if there's any occlusion. And in this case, the doctor is going to cross the left ventricle, right? They're going to advance the catheter, right? So whether it's a JL or a pigtail, they're going to advance it into the left ventricle, and they're going to assess LV pressure, okay? So they're going to assess the LV pressure in the left ventricle. If that is done, then we call that a left heart cath, right? But if they're only checking the coronary arteries, then we go back and it is updated to be coronary angiography, okay? I hope you're following me. Good? Okay, so let's go to the next thing we do. The next diagnostic testing that we do in the cath lab is called a right heart cath. Okay, so just like the name, we're focusing on the right side, right? The right side of the heart. So right heart cath. So right side of the heart, it will be on this side, okay? So right heart cath. So with that in mind, so with a right heart cath, they are literally looking at pressures, Okay, so right heart cath is not looking at your coronary arteries. It is looking at the pressures, the different pressures in the heart. So typically with a right heart cath, these are the kind of patients that you might see this done with, like a patient that's a shock patient, heart failure, pulmonary hypertension patient. We want to take a look at the right heart cath. We want to take a look at the right heart pressures, the pressures of the right heart, and these are the different sections that you will do. So they will do a pulmonary artery pressure. They'll check for that with their catheter in place, right? They're going to use a Swan-Ganz catheter, and they're going to use that to assess that pulmonary artery pressure, the right atrial pressure, right? And then the central venous pressure. They're going to check the right ventricular pressure. They're going to check the pulmonary capillary wedge pressure. So you can see I put like the initials on there, so hopefully that helps. They're going to check your cardiac output and index. They're going to check the patient's systemic vascular resistance, pulmonary vascular resistance. Okay, so right heart cath, if a doctor says, oh, we're going to do a right heart cath, immediately you go and grab the Swan-Ganz catheter, right? Don't open it, just grab it, have all your stuff ready, because you know that they're going to check pressure. So if they're saying, oh, we're going to do a left heart cath and a right heart cath on this patient, you know, okay, we're going to check the coronaries. There's a likely chance he's going to do LV pressures, and then he's also going to do pressures mostly in the artery and the inner chambers of the heart. Okay, I hope you are following as well. Other things that happen during a left heart cath is an FFR, right? FFR is not really separate from a left heart cath or coronary angiography, right? So because an FFR, all we're doing is a wire. So there's a specific wire that's placed, right? And what that wire is going to measure the difference across the lesion. So when the doctor does, whether it's a coronary angiography or left heart cath, and they check those coronaries, right? They check those coronaries, and let's say they find an occlusion. Let's say they find an occlusion right in here. Let this black be my occlusion. So with the FFR, it's a wire that they're going to put in, and the wire is going to go right through the occlusion. So the wire is going to measure, right? So it's going to measure the pressure difference across lesion, okay? So across lesion, that FFR is going to measure the pressure difference. That helps them to know if this is a significant lesion and how much blockage how significant of a blockage is this lesion? Meaning, is it blocking a significant amount of blood flow from going to the rest of the vessels ahead of it? Okay. Another one we can do is IVUS. IVUS also, these are all part really of a left heart cath or coronary angiography, right? So we can do an IVUS. It's an ultrasound tipped catheter that evaluates plaque burden. Okay, so it's evaluating if a plaque is found in the coronary arteries. We do an IVUS to see how significant is that plaque when it comes to disrupting blood flow to the rest of the vessel. Okay, and then we do what we call a ventriculography, also known as an LV gram. So remember, let's go back here. So here, right, remember if we cross the left ventricle, we can assess LV pressures, right, and they can also do an LV gram. If an LV gram is done, we can assess the EF, the patient's ejection fraction, and that helps us to assess their ventricular function. So how well is their ventricles, the ventricular muscle, functioning and pumping blood out of the heart to the rest of the body, right? Because your ventricles are really thick muscles, and they're extremely needed when it comes to pushing blood out your heart, or through the valves, through the vessels, through the rest of the body as well. Okay. So that is it with diagnostic when it comes to the Cardiac Cath Lab. I don't want to overwhelm you today, so we're just going to stop there. Let me know if this video was helpful. If it was, I will continue and we can talk about the balloon angioplasty. We can talk about stent placement. We can also talk about the procedure when it comes to diagnostic, so the actual procedure aspect of the Cardiac Cath Lab. Okay, thank you for watching. Bye bye. Bye.